Of course, you're still watching TVC Breakfast. We'll now link up with Eshomomo Imodu and Tijesu Adeoye in our Abuja studio for the FCT brief. In Akwadonku, over to you, Abuja.
Good morning, Ria, and thank God it's Friday. We are happy over here in the studio. It's a bright and beautiful morning here in the city of Abuja, and we have a lot in our discussion to unpack for you. So sit tight and stay with us.
Yeah, good morning, Nigeria, and so beautiful that today is Friday. You can afford to go into the weekend and have good rests.
I'm sure you look forward to that.
Exactly. Welcome to FCT Brief, your daily morning companion, bringing you the latest on issues shaping Nigeria's future. As Nigeria marks 65 years of independence, conversations are not only about the past and present, but also about the health and well-being of its people. One pressing issue on the national agenda is malaria, a disease that has plagued Nigeria for decades, draining resources, limiting productivity, and claiming countless lives. Despite progress, the country still records one of the highest malaria burdens in the world.
Now local and international partners are scaling up efforts to change that narrative with renewed strategies, increased fundings, and innovative interventions. The goal is bold but clear, ending malaria in Nigeria by the year 2030. This morning, we'll be looking closely at these commitments, the roadmaps unveiled, and what they mean for everyday Nigerians. At 65, the fight against malaria is not just a health campaign, but a test of leadership, accountability, and collective will towards a healthier nation. To help us drive this conversation is a social behavior change communication and seasonal malaria chemoprevention expert, Mary Caleb. You're welcome to the program this morning.
Nice to have you here.
Thank you, and good morning.
Good morning.
Yeah.
Well, malaria in Nigeria, we have battled it for decades. Children, women, old and young, there is no one that has, one way or the other, has tasted of malaria. Now, this target that Nigeria has to end malaria by 2030, I'm sure this has been on the front burner for a long time. But is it going to be achievable? Are we going to meet this target by ending malaria in 2030?
Yeah, thank you very much. Actually, like I said, my name is Mary Caleb. I work with Public Health Department of FCT. So by the special grace of God, we are working towards that and we will achieve that. So talking about malaria, what is malaria? You know, many people mistaking malaria with fever. What is this malaria? Malaria is a very dangerous disease that is caused by a parasite of the Plasmodium through the bite of an infected female Anopheles mosquito. You know, many people, many people mistaking fever with malaria. You have the same symptoms. What are these symptoms? You start having nausea, headache, body aching, and the rest. So the next thing people go to the pharmacies, chemists to say, okay, give me malaria drugs, which it might not be a malaria because you have to be bitten by that female Anopheles mosquito. And you know, many times mosquito can bite people. The next thing they'll say, mosquito have bitten me and I'm having malaria or something. So it's only through the test that you can detect that, okay, yes, this is a malaria. So that's why we encourage people to go to the facility to have a test before taking medication. We discourage all this self-medication and the rest. So when we comply with all these things, by the grace of God, I believe we will achieve it. And you know, this is not just the responsibility of the health workers or maybe federal government or the government. This is everybody's responsibility.
So from what you're saying now, you're saying self-diagnosis is what has stalled, you know, the ending of malaria.
Actually, it contributes. Yes, it contributes.
Are you talking in terms of mutation? Because a lot of people need to understand. You've helped us to understand what malaria is. Now, taking drugs and maybe not properly addressing that malaria parasite. I understand from, you know, research that it sort of mutates. Now, is this what has caused malaria, you know, to prevail till this time?
Actually, like I said, it contributes. Because taking self-medication without proper diagnosis can lead to resistance to the drugs. because taking drugs not on the rules, because, okay, if you go to the pharmacist or maybe hospital, okay, these are the symptoms, this is what you're feeling. The doctor may ask you to go and have a test. After having a test, when the results come out positive, the doctor will prescribe a drugs for you. And they will tell you, okay, this is how you should take the drugs and make sure you complete it. And you know, people have this mentality of, okay, when you take it today, tomorrow, you feel better, they now stop. Okay. So, you know, finishing the drugs will help you to eliminate the parasite in your system. But leaving it alone, it's just like maybe the symptoms are gone and the rest, then you stop. So before you know, you develop resistance to the drugs. And that's why you see many people start complaining that I've been taking the medication and it's not working. So it's because you're not sticking to that prescription that is guided by the doctor. Okay,
how badly does malaria really affect our children and the pregnant women? Now, because in describing you, you said seasonal malaria chemoprevention expert. Now, what is it all about in talking about the prevention and fighting malaria?
Okay, actually, talking about the pregnant women and the children, you know, we consider them to be vulnerable because their immune system are not that strong to fight the malaria. So that is why most of the times these children under 5 and the pregnant mothers goes down with malaria. It's because of their immunity that is not strong. So talking about SMC, SMC is one of the prevention methods of malaria. But that deals with only children. Okay. That is from 3 months to 59 months on the 5. So what is this SMC? SMC is Seasonal Malaria Chemoprevention. Like the word implies seasonal. It's targeted to during the rainy season of malaria because that is the peak that malaria transmission is very high. So, you know, is a combination of 2 anti-malaria drugs. That is SP and AQ. So we call it SPAC. SP and AQ. So SP means sulfadoxacin pyrimethamine, and then AQ means amiodarone. So it is a combination of these 2 anti-malaria drugs that are put together to prevent the children from malaria. And these drugs, it comes in tablets. We call it blisters. It comes in 2 forms. We have the one from 3 months to 11 months, and then we have the one of 12 months to 59 months. It's to prevent the children from malaria, not to treat the malaria. No. So, like I said, it's one of the preventive measures, methods that we are using. Of course, we have other preventive measures like sleeping inside mosquito nets. We always encourage people to use all the methods so that at least the child will be fully protected during this period. And we have eligible children that takes these drugs because even the children, it's not all the children that takes the drugs. Oh. So, like I said, SP and AQ, some children naturally react to these drugs. So we don't encourage to give them. And we always advise that we have a CDDs that are trained. And these drugs, it's not given like in the hospital or you go to pharmacies and buy it, no. They are given in house to house. We have a trained CDDs.
That is like immunization.
Like immunization, yes. CDDs means community drug distributors. They are the people that we picked from the community. We train them on how they will administer these drugs. So they go from house to house. Like they asked in this house, is there any child that is of that age? That's 3 months to 59 months. If yes, they say, okay, we are here to give them the drugs. They have a reflecting jacket, green. You see them, they have identification that they can show you that, okay, they are from SMC to give the children this malaria, preventive malaria drugs. So, like I said, it's not to treat, it's to prevent it. So they give them.
All right. Well, I'm glad that you emphasize the need for preventive measures because we are mostly reactive. And we see that government and partners are banking on new vaccines, stronger surveillance, and grassroots mobilization. Now, how decisive could these interventions be to finally breaking this transmission cycle?
So, like, actually, you see, government is already part of this. Like, I'm from government, and the SMC is one of the preventive measures to fight the malaria. It's recommended by the WHO and the National Elimination Program. That's NMEP. Is part of it too. We are implementing this in about like 21 states in Nigeria. Like FCT is part of it. So with all this, I think we are we are going towards the eliminating the malaria in Nigeria.
Okay. The combination of the vaccine and this SMC, are we saying in some years from now, if this SMC is and this pack you talked about is well administered on those children, we're going to have a situation where we no longer have this malaria and every now and then, because these days you go to a pharmacy, you see a lot of people complaining they have malaria, they take drugs, they treat it, and it's like it's back again, and all that. So what exactly is happening?
No, actually, talking about the vaccine, you know, I think it's only in 2 states in Nigeria that we have the vaccines available in Nigeria for now. But okay, what about the other states? So definitely we have to use the other preventive measures too. Like I said, it's everybody's responsibility. Any way that you say, okay, like this is the way to prevent. Malaria is preventable. And it's everybody's responsibility. Why? So why don't you take part of it? It's not about just government alone. Like, you can use a covering cloth to cover your body, like in the night. Like I said, the children and the pregnant women are more vulnerable. So, you know, giving them all these preventive measures, like to cover them with long covering clothes, giving them sleeping inside mosquito nets, taking SMC drugs and the rest. All this, when you put together, I'm sure it will go a long way to fight the malaria.
Now, you spoke about the SMC, right? Yeah. And you said this is capable of saving lives, especially for the smaller youth, or the children, rather. Yes, this is such a powerful preventive method. You said people should be open to it, but some people might want to take it, but they don't even have access to it. Access is another challenge, I believe. Now, what would you say are those limitations that are standing in the way of, you know, the random children getting access to these vaccines, especially in the FCT?
Oh, actually, getting access to SMC is very easy because, like I said, it's not something that we give in the hospital or maybe you buy in the pharmacies. It's something that we deliver in your house. So like I said earlier, we have trained CDDs that we train them to go house to house to distribute these drugs. They are trained. So what they do is they go to your house, ask, do you have a child of that age? So when you said yes, and we have what we call eligible children, because like I said, it's not all the children that receive these drugs. One, you have to be within that age group. You have to be between that 3 months to 59 months. Because like children, because people ask, okay, what of the children, like newborn from that to that 3 months? They already have their mother's immunity in their system. So it's assumed that their system is they already have a strong immunity. So that children have to be healthy because it's to prevent the malaria. So once we know that the child is sick, we test for malaria. And when the results come out positive, we don't give SMC because it's to prevent malaria. So, and if the child treats malaria within 30 days, we don't give because the drugs the child might react. Okay. Yes, the drugs might be, the dose might be much on the child. So we don't give. And those children that react to that SP or AQ, because some children naturally, like me, I don't take Septrin. Yes. So some children that naturally react to that, we don't give. And how do you know that the child is reacting? You see the yellowish of the eye, the eyes will be yellow, or maybe swelling of the mouth, rashes on the skin, and some stuff. So we advise, and we tell the CDDs that please, if any parents complain that the child is reacting, we have referral form. We refer the child to the health facility. And when the child is at the facility, we treat them, everything is free. So we always advise the parents not to panic. There is nothing to panic about. Just get to the hospital and the child will be treated.
Okay, let's look at this cultural dimension, because in this part of the world, we are very cultural and we have a lot of belief system. And I remember when we were talking about the polio vaccine those days, some people decided not to take because they felt, look, it's going to cause certain adverse effect and all that. Do you have those challenges when in relating with the people, and how acceptable are the various communities to this preventive measure?
Yeah, actually, we have this challenge because, you know, in the community, when you go, many people will be saying a lot of things. So in fact, some people will even say it's just control bad and the rest. But actually, malaria, SMC is very safe it is very, very effective. We have been receiving testimonies from different caregivers, because, you know, it will like become a pattern for some parents to experience this every year. Once it starts raining, their children start falling sick of malaria. It's from one hospital to the other every time.
Even older people.
Yes, even the older people. But now, many people have testified that since they have started taking that malaria drugs, they have, in fact, since that time, they have never gone to a hospital for any malaria treatment or anything related to that. So I think it's very, very effective. And it is very, very safe. And some people, like I said, some children react to this naturally. So you hear some people, when their children react, they go about discouraging other people from taking that. Please don't take these drugs, so because my child took it and the child reacts. So it's not because of the drugs, it's not about the drugs, but I think it's because it's about the child system that doesn't accept that. And that does not mean, and even with that, we have very few side effects with that. And even if it comes, I think it's okay, because it's NAFDAC approved. NAFDAC is into that. The federal government, the World Health Organization, National Elimination Program, the state. So I think it's very, very, it's a very good drugs.
This SMC you speak of is mostly focused on children, I believe. Yeah. So for the adults now, they are more reliant on the treatment, which is the drugs that are available in pharmacies. Yeah. But if you ask a random stranger on the street now who has treated malaria, they might tell you that, you know, I have malaria today, I take my full dose, and sometime maybe after 2 weeks, it's back again, until probably they go to the hospital to get some injections or what have you. Now, how effective are those malaria drugs right now? Because before, you take a malaria drug for 3 days and you're good to go. But nowadays, you just take malaria dose and, you know, after 2 weeks, you have to treat it again. How effective is this treatment?
So like I said earlier, you know, talking about drugs, we have so many things that can be attached to that. You know, some people will just go to the pharmacies, buy malaria drugs and take, without really knowing if it's really malaria. You understand? So like I said, it's advisable, at least first of all, go to the hospital or any facility. Ask, like now, malaria drugs is very free in FCT. You can step down to any government hospital, ask if it's malaria, apart from other this, because, you know, when we tell people like that, if they go to the hospital, they will have some tests and other drugs. When they give them bill, they will say, but you said they are free. But when it's malaria, from the RDT, from the testing, it's free, down to the treatment. So, yes. Alone. So when your results come out positive and you're given the drugs and you stick to you complete your dose, I believe it will work.
Let's look at this other aspect, talking about the acceptance of by the various communities. How involved are various community leaders and religious leaders in helping? Because it's one thing to say a preventive measure is effective, and it's another thing for some people that know how to communicate to the people at the grassroots, to effectively communicate and change their mindset about the whole stuff. So how involved have you integrated the various community leaders and religious leaders in helping to propagate this gospel?
Yeah, actually the acceptance, talking about the acceptance, I think we are growing each day. Compared to the time we start and now, you can see the difference is very, very clear. And we try to bring all the stakeholders involved, like the religious leaders, the traditional leaders, community leaders, all the people that have says in the community. They are all part of this. Like recently, we just did a pilot driving in the churches, because we noticed that most Sundays we miss the children's. Because most of the times it falls on Sunday during the weekend. So we miss them. We just introduced. So like now all the churches in FCT, most of the like so-called big churches are all part of it now. So we try to bring everybody involved. And I think our SBC team are doing very well in terms of creating awareness, you know, sensitization and the rest.
So if a child takes it twice, does it have a negative effect? Because you might have gone into the homestead and you administered it, and probably in the church, the parents decide to bring in their children again. Does it have an adverse effect?
Definitely it will. That is why, like in the churches, we did a finger marking. so that we'll be sure that the child have collected, so that we don't double dose the child. So we, of course, definitely it will have a side effect on the child.
Well, not that 2030 target is set. What are those indicators to ensure that we are on track in meeting this target? Because a lot of people will say, how do we track it? How do we know that we're going to achieve this target? Do you have any key indicators to ensure that you to know that, you know, this target that has been set, we are going to achieve it by 2030?
Like, yes. Like I said, we'll achieve it by God's grace. But it's everybody's effort, like I said. We all have to work together. Like, all these interventions that we are bringing in, we are still bringing different strategies to make sure that we are working towards that. Like all these SMC, net campaign and the rest that we are doing is all working towards, like I said in the FCT2, we have a new intervention again, like bringing the drugs in the FCT, that everything about malaria now, it's free. So you see, all these things are things that are put in place to make sure that we achieve that. Okay,
this is October, and we're gradually getting to a period where governments are preparing the budget for 2026, and if we say we want to end malaria by the year 2030, it has to do with increased funding from the president's speech. Government is doing so much in the health aspect, and one critical aspect is the primary health care. How do you think the various subnational government, whether it is the state government, the local government, preparing for the 2026 will up the game so that from the preventive and from other measures we can all meet at a point while this is working from this end, this is working from this end, and we all meet at a point, because if it's prevention is for the children, the adults also need some measure of health care also. So what can they do to ensure that we're all on the same page?
Okay, actually, like you made mention, everybody is doing their, from the federal government down to state and to the local government level. At the primary health care center, that's the grassroots level. Like I said, many things are put in place, like the malaria drugs for the testing, for the treatments, but we have complicated malarias, of which, okay, what if it's a complicated malarias? Down to from the secondary to the tertiary facilities. All things are there. You know, this is a process that are putting in place. So I think some things are putting in place to make sure that we are getting towards that.
To make this very effective, I'm sure you need a sort of strong sensitization, especially at the grassroots. Now, aside this media campaign, because not everybody that gets a chance to watch TV, what kind of sensitization strategies are you putting to preach this gospel, to make it more acceptable to those at the grassroots and everybody to know that this kind of thing exists and they should key into it?
Okay, yeah, actually, we are doing our grassroots sensitization. Like I said, I think like for the past 3 months, we have been going to churches. We go to the mosque to do sensitization. We go to the communities. We have all this focal group discussion. We go to media houses, radio, TV, television, to sensitize people, to talk to people about this. So I think we are making efforts to make sure that we disseminate the information down to the grassroots level.
Do we see rallies? Have you heard?
Yeah, we do rallies. We do focal groups. We do community engagement. We go down to the community to sensitize them, to talk to them. All these the religious leaders, the Angos and the rest, we engage them.
Now with this SMC, what is your target goal at the end of the day? Probably you have a focus on, say, maybe by the year 2025, 2026, 2027, this is what we want to achieve. Can you help us understand what target you have set for yourself? And by the time you look at what you're doing so far, are you saying that you are running towards your targets, a goal, or there's still more to be done?
Okay, yeah. Our target is, you know, we want every child to be reached. And we want every household to know what SMC is. Because with that, like we said earlier, we are still having some rejections. Some people still don't know what SMC is. They don't know the benefit, they don't know the knowledge about SMC. So our target is to make sure that every household knows about SMC, and they receive the SMC for every eligible child.
So with this rejection, what is the implication? If we have this measure of rejection, will it negatively affect your objective?
Definitely, it will. Because our target is to eliminate malaria. That is just the bottom line, is to eliminate malaria. So when we keep on having rejection, and then the children, we are still having new cases of malaria. So definitely it will affect our target.
Mary Caleb, we must say thank you so much for your enlightenment this morning. It's a pleasure speaking with you. That's why we'll leave our conversation
Thank you
this morning. Thank you so much.